Yes, today's webinar was arranged on the special event to commemorate the Nelson Mandela International Day, which is actually on the 18th of July. But those of you who are in the, in corrections, uh, you know that Nelson Mandela Day is we have the Nelson Mandela rules to for proper treatment of prisoners and inmates. We want to adapt the rules to the current pandemic situation, and this will be a stage where we share updates in Thailand and all over the world on the situation. Okay, so for us to begin the seminar today, our host UNODC, represented by Mr. Jeremy Douglas, the regional representative, Southeast Asia and the Pacific of UNODC, will provide us with his welcome remark. Mr. Jeremy, please.
Hi, good afternoon. Your Excellency Ponprapai Ganjanitra, the Chairperson of the National Human Rights Commission of Thailand, who's here with us with a recorded message, Dr. Wirakit, Harn Parapan, the Deputy Director General of the Department of Corrections, and Dr. Pisset, our good friend from the Thai Institute of Justice. Ladies and gentlemen, good afternoon. Swadika. On behalf of the United Nations Office on Drugs and Crime, or UNODC, I'm pleased to welcome all of you to this online special event to commemorate Nelson Mandela Day. I'd also like to thank the TIJ, our good friends and partner, longstanding partner at the TIJ, for co-organizing this online conference. Both UNODC and TIJ, of course, have hoped to have an in-person event, but due to the pandemic, which we're here to discuss today, it's been impossible. But Nelson Mandela Day is observed every year on July 18th. It is an important opportunity for us to reflect on the life and legacy of the important President of South Africa, Nelson Mandela, who himself spent 27 years in prison, advocating for dignity, equality, justice, and human rights. This day also serves to promote safe and humane conditions of imprisonment, raise awareness about prisoners being part of society, and appreciate the important work of prison staff. The COVID-19 pandemic has drastically affected criminal justice systems around the world and has drawn strong public attention towards the issue of prison management, especially the challenges of overcrowding and public health measures taken in prisons to prevent the spread of COVID-19 among the prison populations. A recent global analysis from May of this year found nearly 550,000 prisoners in 122 countries have become infected with COVID-19, with close to 4,000 fatalities, in prisons in 47 countries, a situation we have seen here in Thailand and, of course, across Southeast Asia. Under these circumstances, it is crucial to strengthen the resilience of prisons against the current pandemic and improve the preparedness of prison systems to be ready to address future public health situations. In this context, the U.S. standards and norms, particularly the Nelson Mandela rules for the treatment of prisoners and the Bangkok rules for the treatment of women prisoners and non-custodial measures for women offenders, provide important guidance for our efforts. I'm very grateful Chair Ponprapai of the National Human Rights Commission has recorded a message for us today. Her role is crucial in Thailand, and we're grateful that she has agreed to share her perspective. We're also very grateful to the Deputy Director Wirakit of the Ministry of Justice, Department of Corrections, who's with us here to share information on recent efforts and developments in Thailand, including updates on the Royal Project, the Good Health, Good Heart campaign. The event today will help raise awareness about improving healthcare and other conditions in prisons, and will provide practical information and updates for prison and correctional officers. Importantly, the discussion will feature experts from our partner, the TIJ, and from UNODC to discuss progress and challenges in implementing the Mandela rules here in Thailand and globally during the COVID-19 pandemic. The event will also serve as a launch of the Thai version of the Nelson Mandela Rules e-learning course, which aims to assist prison staff and other professionals working in prisons to understand and apply the rules in practice. The e-learning course was developed by UNODC as a scenario-based training module, and its Thai version was developed jointly with the support of the TIJ. I'd like to particularly express my appreciation to TIJ for that effort and that partnership. Before I conclude, let me touch on our recent support for prison authorities in Southeast and South Asia during the pandemic. We have been enhancing resilience and preparedness of against COVID-19 and other public health emergencies since October of last year. providing policy and capacity building support for prison authorities in Bangladesh, the Maldives, Sri Lanka, Indonesia, Malaysia, the Philippines, and Thailand. Here in Thailand, some of you will be aware we've provided masks recently for the protection of prisoners. These projects here and across the region, as well as today's event, have been supported by the financial contribution of the United States, and the UNODC very much appreciates this support. I wish everyone a productive and enjoyable discussion today, and I hope that it will lead into further cooperation and truly help to advance the Mandela rules. Thank you all for your kind attention. Stay safe.
Thank you very much, Mr. Jeremy, for your welcome speech. We have already seen this big picture at the regional level. Next, we have a video message from Her Excellency Pornprapai Kanchanarin, the chairperson of the National Human Rights Commission of Thailand. Mr. Jeremy Douglas, UNODC Regional Representative, Southeast Asia and the Pacific. Dr. Pisen, the Executive Director of Thailand Institute of Justice. Participants, good afternoon. I'm much honored to preside over the opening of the prison management during the COVID-19 pandemic and the implementation of the Nelson Mandela rules. This is in line with the current situation, where there are increases in cases of infection amongst the people and prisoners. This is a challenge to the efforts in solving public health problems, economic and the society, especially the management of prisons. We are informed that there are cumulated of over 45,000 cases of infection and over 50 cases of death. The Department of Correction has laid down measures to control the spread, mutation, the density of inmates, the inadequate number of health professionals, and other limitations. These have resulted in severity of the spread. However, inmates should be treated, valued, and respected as fellow human. Inmates are considered a fragile group of people under state detention, especially during the pandemic. They should be cared for and treated with the same standard that the state provides to other citizens. There should be measures to be able to access information, prevention, healthcare, and others in accordance with the human rights standards. There are important regulations as follows. First, the International Convention on Civil and Political Rights, Item 12, on the rights of a person to have the best possible standard of physical and mental health. Member states must take measures to maintain this right, including the prevention and treatment of illnesses. There is also United Nations lowest requirement on proper treatment of inmates, or the Mandela rules, which has in place the basic acceptable standard on good prison management and ensures that inmates' rights are respected. This places emphasis on health issues with 3 to 4 important points, beginning with Rule 24, to provide health service. This is the duty of the state to provide similar care to those of other citizens, free of charge, without discrimination of legal status. Provide health service that closely connects with general public healthcare standards and ensure proper treatment, including providing services in HIV, tuberculosis, and other transmittable diseases and drug dependence. As for Rule 25, prisons must have healthcare stations that can assess, promote, protect, and develop physical and mental health of inmates, taking special care of inmates who require special health care or those who have health issues that affect their recovery. The healthcare working group should comprise of three professions. There are those qualified to provide treatment and healthcare freely, those with good medical potential, and those with reasonable expertise in psychology and psychiatry. In Rule 27, in case of emergency, it should be ensured that all inmates can have immediate access to treatment. Inmates that require specific treatment or surgery should be transferred to facilities or hospitals that can provide specific care. In the event the prison has its own hospital, it should be manned and properly equipped with the potential to provide proper treatment of inmates accepted into the prison. Moreover, our human rights has laid down its operations for COVID-19 situation for those who are involved with prisons and other similar situations, those who have lost their freedom in prison or detained prior to going to court, or those detained by the immigration office. All are at risk of contracting diseases as it is difficult to observe social distancing. This situation should be specifically taken care of with access to information, preventive health care measures, and others. The state should find options of release and imprisonment to reduce risk and effects to health situation in prisons. As for the Department of Corrections, they have holistically assessed and find solutions to the 19 COVID situation. They have worked with the Center of Disease Control for the prevention of spread and treatment of infected inmates in screening, treatment, prevention, and taking care of those who have done their time. Certainly, there are obstacles, including the very low ratio of medical personnel to inmates, the problem of transferring the sick to be treated in hospitals out of prisons, the control of infected and uninfected to be quarantined in Bangkok, and the insufficient IT system to cater to the needs of visits. Participants will learn more from the Department of Corrections. The National Human Rights Commission of Thailand has taken care of a close watch on COVID-19 situation in prisons and have continually provided suggestions and measures to promote and protect human rights. For instance, creating proper understanding by the society without bias on inmates' privacy and their rights to vaccine access. Moreover, the Human Rights Commission has met with the Department of Corrections and staff at all levels to discuss on inmates' human rights on the situation of COVID-19. It has learned of the Department of Corrections' full capability. The Human Rights Commission find that the states of prisons should be corrected and improved from the beginning of the judicial process. There should be a review of the law on unnecessary criminal charges, as well as implementing other punishment measures instead of imprisonment. The Human Rights Commissions will study further and provide suggestions. Finally, I hope that the seminar today will bring awareness on inmates' rights and the working of the Department of Corrections and those involved, and that we have information and guidelines for the effective management of prisons and respecting inmates' basic rights. Thank you.
ขอบคุณเมสเซจจากท่าน
Thank you very much for a message from Kun Pon Prapai. It has allowed us to see a bigger picture now, and we know now that each country has its various requirements. Now we will go into the webinar, and we will learn deeper, and we will on in the country itself and internationally. There will be three topics today. Each, the first of all, the first topic, we are honored by the Deputy Director General from the Department of Corrections, Dr. Virakit Han Paripan. He is here today to exchange with us on the updates on the Good Health, Good Heart project and prison management amidst the COVID-19 pandemic. Dr. Virakit, please.
สวัสดีครับ
Good afternoon.
ก็เรียนท่าน Mr. เจอร์มี่ดักลาสนะครับ
Mr. Jeremy Douglas,
ท่านผู้
the UNODC Regional Representative, Southeast Asia and the Pacific, Ms. Ponprapai Kanchanarin, the Chairperson of the National Human Rights Commission of Thailand, and participants
ท่านนะครับ
and other speakers.
ท่านนะครับขออนุญาต
As for the
เรียนเกี่ยวกับ
Department of Corrections, I wish to provide updates on the Good Health, Good Heart project and prison management
แพร่ระบาด
amidst the COVID-19 pandemic.
ในส่วนนี้ก็จะมีในเรื่องของการดำเนิน
Uh,
โครงการของมาตรการปันสุขทางพอดีเมื่อชาติศาสตร์
Yes, we provide the updates, on the Good Health, Good Heart,
ติดเชื้อไวรัส
and
2019 นะครับ
on the prison management under the COVID-19 pandemic.
โครงการราชทานปันสุข
Updates on the Good Health, Good Heart project.
โครงการนั้นเนี่ยด้วยพระมหากรุณาธิคุณขององค์พระวชิรเกล้าเจ้าอยู่หัวทรงมีพระบรมราชโองการ
The project began from His Majesty's command to assign a commission
เนื่องจากทรงมี
on this project.
ว่าโรงพยาบาลราชทานเป็นโรงพยาบาลแห่งเดียวในสังกัดกระทรวง
His Majesty has mentioned that
แก่ผู้ต้องขัง
state
มาก
the prison hospital is the only hospital under
แล้วก็เป็นการดูแล
the Ministry of
ที่
Justice
สำคัญอย่างหนึ่ง
to serve prisoners,
การที่ทำให้ผู้ป่วยเข้าถึงการ
and that the inmates should be able to access healthcare.
ในเรื่องของวัตถุประสงค์โครงการก็มี
The object
ที่สำคัญก็คือ
There are various objectives.
มีหลายข้อนะครับเช่น
First,
การยกระดับการดูแลสุขภาพผู้ต้องขัง
leverage healthcare of
คนภายนอก
inmates so that they match the level of those
เป็นการจัดระบบ
free people,
พยาบาลให้มีประสิทธิภาพตลอดจนปรับปรุงอนามัยสิ่งแวดล้อม
improve the situation,
รวมทั้งการจัด
improve the system,
การแพทย์สำหรับ
find better equipment of the hospitals in the prisons,
ของเรือนจำต่างๆพัฒนา
develop
การแพทย์ของกรมราชทัณฑ์นะครับ
medical
ความรู้
people
พัฒนาอาสาสมัคร
under the Department of Corrections, and also
เรือนจำนะครับ
develop various
ก็คือเป็นผู้ช่วยเหลือเจ้าหน้าที่แพทย์
volunteers to help, especially in nursing. And these we chose from good quality inmates. On the 28th December, we were graced by their majesties, they who opened the project at the prison hospital in the first stage. This Good Health, Good Heart project is of great value to our project. His Majesty has granted over 190 million baht with over 700 pieces of healthcare equipment.
จำนวนเงิน98 ล้านเศษนะครับให้แก่เรือนจำ 24 แห่ง
24 hospitals received 98 million baht.
และให้แก่หน่วยงาน
Another 24 hospitals received over 47 million baht.
ทั้งสิ้น 43 ล้าน 396,813 บาท
And the Corrections Department hospitals received
117 ชิ้นซึ่งรวม
over 43 million baht. Have this AI mobile X-ray.
โครงการใน
The
ก็ใช้แล้วดำเนินโครงการไปประมาณ
stage 1 took about 1 year and assessed, and it was expanded into stage 2. More medical equipment were granted for the project. Their Majesties have presided with the various directors of the prisons, the Director General of the Corrections Department, and at various other, and we also had inmates to were granted this royal the visit. Their Majesties have mentioned that they were glad to have heard that all are glad, all inmates had their livelihood improved, and glad that the equipment will be used for proper work. And their Majesties have granted their kindness. In this project too, we received various equipment to hospitals, and there will be into the major hospitals, 191 items over for valued at over 102 million baht. These being 16 of these at 338 units, over 15 million baht, and altogether 100 and over 118 million baht worth of equipment. This phase two is improved over phase one on, various the nutrition, the rights to health care, sanitation, water treatment, waste treatment, and various activities to develop the project. And these actually came before the spread of the pandemic. It was Their Majesty's wisdom to have foreseen the difficulties and have granted gifts presents to various hospitals. These are the maps where hospitals in phase one have received. On the right are prisons in phase two, and there are various detailed. As I will provide information on the management of prisons amidst the 2019 situation. Right now, the most updated information from until the 28th of July. All these information have been collected from the 1st of April. We have various management centers, the COVID management centers under the Ministry of Justice. There were reports on COVID situation on the 20th of July. That was yesterday, which was His Majesty's birthday. We have over 143 places, 143 prisons, 112 we had no spread, and only a few had spread of COVID. So it's only about 10% of the prisons. There were new infections today, 202 infections. So altogether, accumulated infections over 45,000, and we were able to treat over 37 cases, and that's about 83%, and 7,102 are under treatment, and there are 55 deaths. If we calculate into percentage from the over 45,000, of infection, it's only about 0.1% if we compare to the which is about 7 to 8 times less than those outside persons. The most infection was in Bangkok and its satellites, and only there were 43 deaths, and we have 3,000 under treatment. In the regions, there are still cases increasing, but from a thousand from thousands to hundreds a day. So altogether, in the regions, 105 and 204 were treated, only with two deaths, and cumulative deaths 55. We have 14,000 staff. There were vaccinated, 13,000 were vaccinated, and another 679 awaiting vaccinations. And with over 310,000 inmates, we already vaccinated over 100,000 doses. The first dose, 54,000. Second dose, 51,000. It's about 20% that were vaccinated, because we emphasize on high risk groups, persons in the white zone and the red zone, and persons in the red zone, and then we have white persons in the white zone. Our principles for operation in COVID-19 situation was preparation, which we prepare in various aspects. Information, daily meetings, and we do it every day to gain updates on the stock, our storage, on equipment, medication, on vaccine updates, reports on situation, the severity, and prepare to exit. Those who are released from uh, the and we also take care of the security, safety, and security of the prisons when we need to get new prisoners who are high risk COVID. We have to manage this, where we actually have a temporary zone, and we have to cooperate with human rights too. I will go a bit faster. Uh, the policy measures and management. We have a management center. Yep. By the corrections department, we screen new inmates, and we quarantine them. If we find them, at low number, then we send them to outside hospitals, and we do RT-PCR screening. We also have quarantine zones. And as for current management, we provide vaccines to the high risk groups. We provide vaccines to our staff, and also we set up our operations team, and we increase number of the people. And thank you very much. And that the Department of Corrections will take care on the rights of inmates who are under the care of Department of Corrections, on basic human rights, on the rights of healthcare. Thank you very much for your interest. Thank you very much. Thank you very much, the Deputy Director General, for your presentation, which is very useful and is actually of interest. And we see, like now, right now, the frontline people are working hard, As for the Good Health, Good Heart project, we actually see a great progress because over 40 prisons are already under this help, and vaccination has gone over 20%. Now that we have already seen the situation of prisons in Thailand, let's take a look at the international, at global level. Let us see about prison health internationally, what it's like. And we are honored by Kun Chontit Chitnura, Director of Officer of Bangkok Rules and Treatment Offenders, the TIJ, and we also have Kun Piara Bazano, the consultant of Thailand Institute of Justice. They will share about the study of COVID-19 impact on prison health. Kun Chontit and Kun Piara, please. Thank you so much, Kun Salila. Thank you, everybody, for joining us here today. Those in Thailand and those who are everywhere else. And the presentation that I will be presenting together with Kun Piera is that we want to present our studies on the impact of COVID-19 on prison public health. At TIJ itself, we have carried out this project last year since last year's August. The institute, we looked at COVID-19 as a critical public health issue, and that in various countries have faced this problem, and they were worried and were anxious, and we discussed this at international stages, like at the United Nations, and they promoted the studies on these issues, so it will be beneficial to design policies in the future. And especially in the year 2020, it was an anniversary, the 10th anniversary, and it was the fifth anniversary of the Mandela rules. So we want to recheck the state of the prison and managing this pandemic all over the world, what it will be like. So we got information from various regions, like here in Asia, Latin America, Europe, Africa, and North America. And I will pass to Ms. Piera, who is the chief researcher from TIJ. Kun Piera, please.
Thank you very much, Chontit, and good afternoon. The report is based on a wide array of sources, including academic articles, recommendations by international organizations, replies provided by prison administration to a questionnaire that was sent out to the TIJ, interviews with experts, prison officials, prison healthcare staff, and former prisoners. The main and most obvious finding is that the COVID-19 outbreak has magnified and intensified all pre-existing problems affecting prisons worldwide, forcing many administrations to acknowledge long-standing shortcomings in terms of infrastructure, equipment, and human resources, as well as, and that's very important, the relations between the prison administration, prison management, and the prison healthcare providers. And this has been also a dedicated chapter in the report, trying to highlight how different countries have organized their prison healthcare, under which authority. Secondly, COVID-19 has been defined as a game changer in many respects, and as such, it represents an opportunity for criminal justice systems to review punitive policies typically centered on imprisonment which is applied too often and for too long. and to better understand the importance of relevant international standards, first and foremost, the Nelson Mandela rules that we celebrate today, and the Bangkok rules, but also the Tokyo rules, which are essential to support and promote the creation of a comprehensive set of non-custodial measures and sanctions. The pandemic has catapulted prison healthcare to the foreground. In many countries, lack of resources and political will have often contributed to underplaying the state's responsibility and duty of care towards prisoners, including the provision of healthcare and salubrious conditions of detention. The challenges of prison healthcare are enhanced by the variety of pre-existing health problems displayed by a high percentage of prisoners. Thus, the COVID-19 outbreak has hit harder the prison systems that were already operating under strain, where prison overcrowding made social distancing and quarantine or confinement practically impossible, where personal protective equipment and sanitizers were not available, and where testing kits were insufficient. The most immediate steps taken in many countries were reducing the influx of new prisoners, also because of the scaling down of court hearings in many jurisdictions, and releasing certain categories of prisoners, vulnerable prisoners, prisoners with underlying health conditions, aging prisoners, and many petty offenders. For example, this has been the case in the UK, USA, Ireland, Kenya, Burkina Faso, and India. Common countermeasures aimed at reducing the exchanges with the outside world included the suspension of family visits and intimate visits, as well as external work or schooling, reduction of activities carried out through the support from external actors or therapists, and the suspension, as I said, of court hearings. For example, Thailand introduced similar measures according to the principle, no exit for insiders, no entry for outsiders. Nonetheless, prison staff continue to represent the higher risk of contagion, being the main vector of infection from and to the community. Furthermore, prison staff has been left alone to look after the prisoners, and at times this has been really almost heroic, given the situation in many countries where the prisoners were left really to their own, and prison staff had to work well beyond the call of duty, trying to alleviate the situation and also calm down the prisoners that were worried about their own health, but even more so about the health of their families. This has been, for example, in the Brazilian state of Bahia, prison staff has been trained to detect early signs of COVID-19, so that they were actually able to extract the prisoners without the doctors having to go in all the time. And also, of course, the dark side of this prison staff being left alone with the prisoners has been that there have been some cases of abuse of power and even maltreatment or torture, because also the external monitoring activities were put on hold in many countries. Monitoring activities have been scaled down in many countries, as I said, but there have been notable exceptions. For example, in the Brazilian state of Santa Catarina, where the committee headed by a judge of criminal execution has been carrying out regular inspections in the two prisons in Joinville, and has been really essential in also listening to the prisoners, alleviating their stress, and also listening to the prison staff and their concerns. Interestingly, in many countries, the taboo of mobile phones in prison was broken to allow a minimum of contact between prisoners and their families in replacement of family visits. And some countries like Cabo Verde have introduced Skype calls for this purpose, and also to replace, to some extent, psychological therapy, and also to allow prisoners communication with their legal counsel. Interestingly, telemedicine has also been used in some prisons, for example, in the UK, in the USA. And for sure, I have the impression that technology is here to stay in the prisons, even when the pandemic hopefully is leaving our lives for good. Countries with less resources, such as Burkina Faso and Kenya, were able to tap on external partners, for example, ICRC, to receive some phone equipment and airtime, again, to guarantee this possibility for the prisoners to keep in contact with their families, at least on a minimum. One of the problems that emerged from the study is the paucity of reliable data concerning COVID-19 cases in prisons. Many countries indicated that the real numbers were likely to be much higher due to the insufficient testing capacity and the fact that younger prisoners tended to be asymptomatic. So only symptomatic prisoners were going to be tested, and this, of course, has kept the number of cases down in some jurisdictions. The pandemic has given new relevance to protocols, especially to detailed preventive measures and procedures to be followed in case of a suspect COVID-19 infection. And some countries like Kenya have expanded existing protocols, whereas other countries, like, for example, Madagascar, have developed new guidelines. A major challenge throughout the world has been the provision of regular health care during the pandemic, catering to the various needs of the prisoners affected not only by urgent conditions, but also chronic illnesses, drug use disorders, mental health problems, etc. Especially women prisoners have suffered more from the measures imposed to prevent the spreading of the virus, and such as the suspension of family visits, and their mental health care needs have reportedly increased tremendously during the pandemic. Concerning vaccines, their uneven distribution throughout the world has had an impact also on prisons. Few non-Western countries have managed to ensure vaccine for the prisoners, and it was very encouraging to listen that Thailand is very well on course to guarantee these vaccines for all the prisoners. And also the Argentinian province of Buenos Aires also had plans to offer vaccines to the entire prison population, even the families of prisoners and prison staff. And as the pandemic follows its tragic course throughout the world, prison systems continue to face new challenges. Reporting on their experiences and responses is a work in progress, and the exchanges of practices and lessons learned at the international level can help many administrations to find better solutions to their problems, as I think that we've seen that this pandemic has for sure taught us that pretty much we're all in the same boat, unfortunately. So thank you very much.
Thank you, Pierre. So ขออภัยค่ะในส่วนของที่คุณ Pierre เล่าให้ฟัง
As much as what Pierre has mentioned, it's a key finding of research where we still have to improve on. The complete research can probably be disseminated shortly. I would like to let you know a little bit more on the suggestions from the, from this report where we want to present today. I think it would be beneficial for discussions. We divided into two parts. First of all is the lesson learned from various countries, how they dealt with COVID. And this will be a guideline for future handling of the situations. So we actually have 6 suggestions. First of all, is what we call the reduced prison overcrowding, and this is one of the most sustainable way out for any crisis that will occur with the prisons in the future, which means uh, we we reduce the detention, and we also promote other punishment instead of detention, and then leads to number two is that to solve the crisis in the prison. It's not just only corrections department. It's We find it an integration, a cooperation from all the stakeholders in the judicial system, all the way from the court, the prosecutor, etc., etc. Third, this research, we wish that it's a good investment in healthcare services in prison, because yeah, we actually saw how fragile the prison is, right? The improper ratio of personnel and medical equipment. So now we see that the prison is actually very fragile with future problems. And number four, we want to promote the most basic readiness, that is by applying international regulations, like maybe also the Nelson Mandela rules or the Bangkok rules, to adapt to prisons at during general situations. This will actually strengthen prisons, and the management of prisons will meet international requirements. Now we have number five, where we go deeper into management of prisons, which is closer to the Mandela rules, that the public health and the prison should cooperate closer, so that the health services in the prison will actually be similar to those of the free, and so that we can also be confident that their treatment will be continuous once they leave the prison. Number six, just like what Pira said, many prisons assess their protocols, or their management. When we take out comparing the protocols to the crisis, and we have to assess that and develop the various protocols or the processes and operations that will be better for in the future. Now, second set of recommendations, we we aim for we aim this towards prisons who are actually dealing with the crisis. Number seven, we look at the reduction of the number of prisoners, and various countries are actually doing this. Maybe like immediate release, or under certain conditions to reduce overcrowding. This piece of study, there's a bit there is a bit of caution, because if we release a large number of prisoners, then we also need to prepare better, especially we're helping them out after we release them, and also especially in this COVID situation where it's actually very difficult to find proper place to stay or find work once they are released. Number eight, it's about prison management. We need to provide clear information to the prisoners, like controlling the COVID in the prison, or even the situations outside the prison. We need to uh, lower their anxiety. The information can be in written form, or not written form. So because some of them are illiterate, and some of them may have their regional language. Item 9, we want to promote the use of technology. So we know various countries, including Thailand, we use technology for prisoners to contact with the families, and this is a good sign, where the Department of Corrections find its importance. But however, if when the situation has eased, this technology can still be used to promote in the future, to promote visits in the future. Like it could it could have various effects. Item 10 is on information collection. This is very important on especially on COVID spread. We have to go in depth of the data, maybe like the sexuality, the age, the time in prison. It could even be also those. These will provide information to the agencies and will be evidence-based policies to those agencies to come up with policies. Number 11, we emphasize on the importance of vaccine, for officers and staff, and as well as the prisons, because we may not be able to maintain social distancing. So in this plan, in the national vaccination plan, they should also consider those in prisons and or working in prisons. And lastly, the number 12, we place emphasis on the stress or the mental health, especially on these strict measures. So we have to consider them all together. So initially, these are some of our suggestions where we wish to let you learn about today, and but the full report. Yes, we see in the chat box that asking for the report. I think that by the middle of next month, we this report should be complete, and so please follow TIJ's social media and channels, and we will post it through various channels. Thank you. Thank you very much, Kun Shontit and Kun Piera, for these information. So we see this from the international view. This is actually very fragile issue. In prisons all over the world, not just Thailand, and the changes in policies, whether investing in better public health and also building partnerships. These will actually be important factors that can tell us more on, in the event of future crisis, how well we can do. As for uh, our speakers at our last section, we will exchange some information that will benefit, correction departments staff all over the world. We are we've received so Kun Naoki Sukanov will tell us more. Who he will send will have a talk about the introduction to the Nelson Mandela e-learning course, and will update various projects where UNODC has policies on helping member states on managing prisons. Kun Naoki, please.
Thank you for the introduction. Her Excellency Pom Prapai Kanjanarin and Dr. participating for giving us the video statement, and also Dr. Virakit Hamparipan for his presentation. Thank the very informative presentation of the UN Regional Office in Southeast Asia and Pacific. I'm responsible for the Criminal Justice Sub-Program of the UNODC Regional Office. It's a great pleasure to meet you all, and thank you very much for your interest in this event. Could you change the slide, please? So at the beginning, let me start with a very brief outline of what our team, UNODC's criminal justice team, do in area. UNODC support the member states strengthen many, for example, the name cross-border sexual offenses or violence.
คุณนาโอกิยังอยู่ไหมคะ
Kunaoki, are you still with us?
น่าจะเป็นปัญหาทาง
This is some technical glitch with the internet connection.
เดี๋ยวรอสัก
Let us wait a while.
Hello, I'm sorry, my internet connection was lost for a moment. Can you hear me?
สวัสดีค่ะคุณนาโอกิได้ยินค่ะแต่ว่ามี
Yes, Kunaoki, we can hear you, but the signal was breaking up like this.
Okay, so I'm sorry for the lack of connection. So one of our work, UNODC is the custodian of a number of UN standards and norms, and we continue to advocate for their implementation across the region. And this includes the area of prison management. So could you change the slide, please? Yes. So turning to our mandate on prison management, UNODC has the mandate to support countries in reforming their prison systems in line with human rights principles and UN standards and norms. And within this mandate, we at the regional office has been providing support on prison authorities of Southeast Asia for many years. And today, as the previous speakers have mentioned, the COVID-19 pandemic poses big challenges to prisons worldwide because people deprived of liberty are more vulnerable than the general public because of the confined and congested conditions in which they live. So UNODC has responded quickly to support the member states and have provided practical advice to several countries to address prison overcrowding, and we have also provided supplies to enhance their preparedness for public health emergencies. Next slide, please. So in September 2020, that's last year, with the funding support from the United States, UNODC has launched a new project for the region. The project targets countries of South and Southeast Asia, as you see in the slide below, and it aims to strengthen the preparedness and resilience of prisons against the current pandemic and against the future public health emergencies. I see in the participants list that we have several counterparts, many people from our counterparts in the region participating today, and we are very grateful for their interest. So the next slide, please. So this project aims to achieve 3 outcomes in 24 months. And at the policy and strategic level, prison systems be prepared with adequate policies and strategies. And at the frontline working level, prison officers' knowledge and capacities are developed to respond to the pandemic and the health crisis. We also provide support for the facility and infrastructure so that the prisons are adequately equipped to respond to public health situation. The project have made good progress so far. In the previous slide, there was a picture that highlights some of our recent achievements. We were able to provide 1.5 million surgical masks to the Thai Department of Corrections this June, which was quite timely considering the dramatic increase in the COVID infection. So next slide, please. So The purpose of the event today, one of its purpose is also to use this opportunity to launch the Thai version of the e-learning course of the Nelson Mandela Rules. The Nelson Mandela Rules consists of 122 rules that gives guidance on all aspects of prison management. And in order to help the prison staffs and practitioners to understand the rules and to apply them in the real-life prison settings, we have developed a unique interactive scenario-based training course. And today I'm very pleased to present that the Thai version was developed recently with the support of TIJ. Next slide, please. So the Mandela Rules e-learning course is free, self-paced online course and available in various languages, not only English, Arabic, French, German, and Russian, but it is also provided in Thai, Indonesian, Malay, and Vietnamese, the language in our region. The e-learning course consists of 7 interactive modules, and each takes about 30 minutes, so it's about 3 to 4 hours to complete the whole course. And it covers the essential ideas of the 122 rules of the Mandela Rules. And upon completion of the course, there will be a small test, questions, and you will receive certificate upon success. So I said there are 7 interactive modules. First one is introduction, and the last one would be the evaluation assessment. So there are the remaining modules cover the 5 core areas of the prison management. So prison conditions covers basic services of imprisonment like accommodation, hygiene, nutrition, and the prison regime looks into management practices of the prison, also including rehabilitation programs or services for reintegration. Proper risk assessment is also focused in this section. Safety and security is about how to maintain safe and secure prison environment, focusing on dynamic security. And it addresses conflict resolutions or what to take into consideration in disciplinary actions. Healthcare is about providing guidance on physical and mental health services in prison, and the role of healthcare professionals in prisons are also highlighted, and how their views or opinions are to be treated by the prison officials. Those are also dealt with in this section. Safeguards is about mechanisms to ensure integration, integrity, legitimacy, and accountability of the prisons. Thank you. So this is how the module looks like. This section is about, this is example of prison conditions where it addresses the environment of accommodation or nutrition, what to eat, or the clothing and so forth. Each of the modules consists of 2 parts. First part is on learning about the rules, and it's the introduction to familiarize the user with the rules. And the second part is putting the rules into practice. The second part, the putting rules into practice, is the sort of interesting part. Each modules have like 5 to 6 interactive video questions to watch. Could you show the next screen, please? So this screenshot is from a video question related to prison safeguards. This is a situation when you have external inspections arrived with a very short notice. So it provides a certain settings in the video, and after you watch the video, you will be asked multiple choice questions to answer. And once you choose your answer, there will be another video shown to see if you chose the best answer. The answers to these questions are not always black and white. So sometimes your answer is okay, but there may be better ways to solve the situation. Explanation is often given based on the Mandela rules to let you know why it's the best answer or why there are better ways to deal with the situation. And this is where you can really learn the most and familiarize yourself with the Mandela rules. So this part, this video part, is very well designed for the learners to think deeply and also to have discussions with your partners, your colleagues, if you are doing this in a group settings. Next slide, please. So as this e-learning course is available online and it is free of charge, it can be quite easily integrated into training curricula for the prison staffs. And since the launch in 2019, 35,000 participants from more than 150 countries have enrolled in this program, and more than 20,000 have successfully completed the course. There is a link from the UNODC Global Learning, and the way to register, more details will be provided later from our TIJ colleagues. So I hope this will be found useful for the Thai authorities, and we, the UNODC, would be happy to support the rollout of this training for the Thai officials. Next slide, please. So in closing, I would once again like to thank our Thai partners who are represented today and everyone who has joined us for this event. I believe this event will mark an important step for our stronger response to the pandemic. And I thank you once again for your attention. Back to you.
ขอบคุณค่ะ
Thank you very much. Thank you so much, Kun Naoki Sukano, for this beneficial presentation. And for those of you who are interested in the Nelson Mandela course from Thailand, you can actually see in the chat box, our team has already, sent you the instructions how to get into the program. Next, we will go into exchanges, the exchange and the Q&A in the chat box, Q&A box, and also through hashtags. We do not have much time. We may have about 2 to 3 questions. The first one, I think this will head straight to Director Virakit. It's a questions on the present situation in Thai prisons. Maybe you have mentioned a bit on this. However, the question they want to know when you take care of those infected, in with the staff and the prisoners, the Department of Corrections, what are the measures you take to separate them and other than vaccinating them, other care you take? Okay, thank you very much for the questions. With this COVID situation in the prison, it is actually similar to what's happening outside, except that our target is to provide vaccine where prisons are very dense, white prisons in the red zones. So I think sooner or later it's going to burst. Like say in Samut Prakan, we gave them, we vaccinated them, and then there was a spread. The result of vaccination, the vaccination could not prevent new infection, but it helped protecting the whole prison. There was no serious sicknesses, so we providing vaccines to the whole prison, like in Samut Prakan. That's where we vaccinated. The result, we had no deaths, in Samut Prakan. Yeah, we vaccinated them in time. As for the staff who were infected, we separated them out into out to to outside hospitals, and we treat them until it's we give them like 28 days, and once we tested them for antibody and immunity, and then we can actually get them back to work. That our staff, most almost 100% of our staff are vaccinated, maybe like about 90-ish%. But we still have our daily infection. But yes, they were vaccinated. Vaccines cannot prevent you from infection, but the symptoms won't be severe. And taking care of the prisoners who are infected. So we we triage them into like green, yellow, and red. If it's green, we let them stay in prison. And okay, in the case of like say we find new prisoners who we found them positive, we send them to our network of hospitals. But in the event where it's uh, where things burst out, like we have a lot of infection under hospitals, then we will set up a field hospitals in the prison, and we will treat only the green, but those yellow or red, we transfer them to outside hospitals. And for taking care of prisoners in the prisons, maybe we could like bubble and seal them or separate them, and we use the process of public health. We separate them. We provide them, with basic medication. Right now it's the herbs. Even though you are not positive, we still provide them with all these herb at the correct number of milligrams. We also provide them flavid pyrovia for those who have just beginning to show symptoms with low oxygen, with okay chest X-rays. So we provide them with flavi medication right now because they are actually in this limited area. Because if we provide with the medicate them with flavi early, it will help reduce the chance of requiring respirators. Uh, yeah, and when if we need to use beds and respirators, that would make it difficult. But say like in Chiang Mai, they were able to help the sick of pretty well. But okay, we actually took care of of the prisoners in accordance with our project very well, just like those people outside. Thank you very much, Dr. Virakit, for these explanations on the measures. So that means right now things have to be adapted daily. We have another question that's probably for every panelist, and I think it's actually very interesting. This issue may be something that maybe our audience can share your answers. This question number two is in our Q&A. It's about the conflict between human rights and disease control. The from the panelists' views, how do you balance these two issues? Like in some countries, is it like that a prisoner can deny vaccination, or we do not allow them visits for like a certain time to prevent infection? Was there any complaints, not just in Thailand, but any other countries? Maybe there's some other panelists, maybe you can help with this. Maybe Kun Pira?
Thank you. Well, I have to say that by the time I finished the report, which was at the end of March, I had not come across any issues about the obligation for the prisoners to accept the vaccine. It's a very interesting point, and I'm sure that by now some cases must have come to the fore, and I think it probably depends. There are a lot of debates even here. I'm in Italy, and they're talking a lot about, for example, an obligation for the vaccine for medical staff and teachers, and it's a very hot debate. So it will be interesting maybe to explore a bit more what has happened in the prisons, because as I said, by the time I finished the draft, most countries were still we're having a lot of difficulties in even ensuring enough vaccines for everybody. So I didn't come across that specific point. Concerning the suspension of family visits, of course, as I mentioned, it was a big issue in many countries. From the replies I got from the questionnaires and also the discussion I had with different stakeholders, I think that the key was to make sure that the prisoners were properly informed about what was going on. There were massive protests and even riots in Latin America, in Italy, in France, in many other countries when the measures were first announced, probably because they were not filtered through proper information. That's why I think one of the recommendations at the end of the report is to make sure that you keep the prisoners properly informed. Of course, if you're in a prison and you just get bits and pieces of information and you cannot see your family anymore, the obvious reaction, of course, is to panic and even to resort to violence in order to try to get some information. And I think that it has been accepted as a measure to ensure that public health is preserved, to suspend family visits. Of course, this has to be limited in time, and it has to be circumscribed. It cannot become a common practice. I see a risk of prison visits being replaced through video links, because many prison administrations have realized that that's very cost effective and very simple. And this is absolutely should not happen. So the thing is that this is a kind of a state of emergency. You can suspend even important rights like the right to be visited by your family, but you cannot make it a practice now. Okay, it's much more convenient and cost effective. We don't need as much staff. Of course, the presence, the contacts, direct contacts with the family and especially children is essential also in terms of social integration program for each and every prisoner. So I think that this has to be like a parenthesis due to the current circumstances. Thank you.
ขอบคุณคุณเพียร่ามากค่ะ
Thank you so much, Pira. Anyone else want to share more information on this? Okay, thank you very much, Kun Salila. This is just like what Pierre says that it's still debatable if the vaccine is mandatory. But when we were carrying out our survey, we did not come into this issue. But when our information is more complete, we found that in some countries where the vaccinated prisoners, they didn't actually make it mandatory. They just offered shots to prisoners. But personally, in my opinion, I think whether to make it vaccine mandatory or not, I think in the case of if they want to deny vaccine, is there anything that any measures that prison would have, like maybe prevent overcrowding, providing safeguards in the prison? I think we need to think together in parallel. So they need to adapt. And to actually facilitate proper social distancing, and the vaccine itself can be an additional support to strengthen the prevention. And this is something we see in some countries. Another one is about the family visit, where it's the right, it's the right to be visited with families. And yeah, so what we see, in the situations everywhere in the world, they understand the high risk on about contact, and the risk that can be to the visitor themselves, or even to the prisoner. So we see this is an opportunity to bring up this issue of visit by through the use of technologies. In some other countries, they use technology, maybe Zoom, Skype, Line, or whatever, or even through normal phone, right, in the past. This is something that maybe we can discuss or study further, or even maintain this rights, or how can we go back to some other previous techniques. This is an opportunity for us to think about. That's all I have. Thank you so much, Kun Chontit. Actually, we have a lot of questions coming in the chat box. Kun Naoki, do you have anything to add on this?
Well,
All right.
just very briefly, I do agree with the previous speakers that this is a debatable and ongoing discussion about the vaccine in prisons. But I think it would, just like Pierre said, it's pretty much depends on the circumstances and situation of the prisons, and how the prison settings is congested, whether in case maybe there is clear and imminent danger for the other prisoners, there may be situation that sort of mandatory or semi-mandatory vaccination might be required. I think this is something that will be further discussed in the international communities. Regarding the visits of the families and so forth, UNODC is also providing support for the member states based in our project with the South and Southeast Asia. Upon request, we would be ready to willing to provide some material or technical support for that use of online digital IT equipment to facilitate these visits and communications. Just wanted to say that at this time. Thank you.
Thank you so much, Kun Naoki, for your answer. We have many other questions in the Q&A, but we may not have much time for Q&A. But there are some questions about the Nelson Mandela e-course and other issues related. Okay, our panelists, maybe you could answer that in the Q&A. All right. Our time is now in the last leg of the activity. Before we end the webinar today, we are honored by Dr. Piset Saat Yen, the Executive Director of Thailand Institute of Justice, who will summarize and give us the closing speech. Dr. Piset, please. Thank you so much, Kun Salila, dear Excellency Pon Prapai, Mr. Jeremy Douglas, UNODC Regional Representative, and participants. It is a pleasure to provide this closing remarks on this occasion of Nelson Mandela International Day. I wish to thank the UNODC. As you know, you are our partner with TIJ and have joined us to host the event today. Thank you very much, the panelists, to have shared your experience on Mandela rules amidst the COVID-19 pandemic. Honored guests, we understand that the Nelson Mandela rules is an international guidelines and standard for those who are involved with prison management, and This is to ensure the basic rights and dignity of the prisoners. This is an important part of prison management. However, this rule is not a legislation, but an international, at the global community. This is something that we agreed on to implement the rules. And about 60 years ago, where the UN resolution has approved this rule, and we find that very many countries have tried to amend the laws for their corrections department. And in Thailand itself, we have amended the Corrections Act to go in line with the international standards. As for the public health issues in prison, the Mandela rules is actually place great emphasis. As we all know, that most of prisoners, some of them are actually at health risk higher than others, and there are quite a number of prisoners. They the background, they do not have very good economic, like in poverty, they do not have proper health access, and maybe they could have other health issues, involved with drug use. And when they come into prison, combining with the overcrowding in prisons and limited resources, this can actually make their health issues worse. So, especially now, with the situation of the COVID-19, this actually reflects, it's a good reflection that, we can see how fragile the prisons are. So we need to place emphasis on our cooperations so we can manage and go through this crisis without without leaving them behind. For the presentations from our panelists, from Joltit, for all four of you, has shown how hard you are working to control the spread, and there are various measures working together, Ministry of Justice and Public Health, and we see the roles of cooperations, right, from various agencies, and we learn about the impact of COVID on health issues internationally, right? And it is actually exciting to see researchers in this, the researchers that will actually come out soon, so we can learn more from the suggestions where we can benefit better. And importantly, we see that the implementation of Nelson Mandela and the Bangkok rules, we adapting all these, how it can help the effective management and of the prisons, and maintain the dignity and rights of those being detained. And TIJ actually has placed great emphasis on developing the skills and knowledge to the prison staff, and because they are the key players in taking care of prisoners, in accordance with international standards. And TIJ is actually, we are actually glad to cooperate together with UNODC to develop this electronic course on Nelson Mandela, e-learning course. And we hope that this will actually help improve the potentials of the staff, that they can actually implement the Mandela rules. And I think this online learning will actually make it easily accessible to our prison staff. Although, while we need to keep proper social distancing, I truly believe that we all know, yeah, that the spread of COVID-19 is is a big problem, of the justice, because we need to come up with various measures that are actually proper. We need to have short-term measures where we need to take care of immediate healthcare. We need middle-term measures, and also we need a long-term measures to actually promote, you know, over to lessen overcrowding. And lastly, I wish to thank all agencies, everyone involved, to actually have put in your best, to actually demonstrate the importance of proper care of prisoners. Thank you very much, the Corrections Department, to have helped us through this crisis. And I hope that this webinar today will be a good starting point where we can work together and leverage, the Corrections Department work and strengthen it, being more effective in the future. Thank you. Thank you so much, Dr. Piset Saat Yen, for your closing remarks. So the event today is ended very well. You can see a replay of this event at the tijthailand.org. So before we go, please, reply our feedback form that will actually appear in the chat box. Please, we also have another link through your email again, so we can actually improve this event, various future activities. So thank you very much, all of our panelists. Uh, Thank you very much, all of our audience all over the world. We see it from Philippines, Singapore, and various other countries in the ASEAN region. Thank you very much for coming in today. Everyone, please stay safe, take care, stay healthy. Meet again next time. Thank you very much.